Hello, mindful members. I am Dr. Lucie Bianchi from the Mindful Medi Spa and Medi Clinic. We are a direct primary care office, as you all know, and we are still accepting members, as you all know. Today's video is regarding elder care, and I think January and or winter is the best time to kind of review what can we do to help older folks get by during this pandemic, as well as any winter, even when there isn't a pandemic. Now, currently, a lot of our elder community has been locked up really for about 9 months. 9 months, they've been extremely limiting their socialization by not participating in holidays, probably missing family celebrations, and not going to movie theaters or other social engagements. Now, as we know, one thing that can happen when people over 65 start to limit their social circle, that is a risk factor in of itself for dementia. So you're more likely to exhibit forgetfulness and so forth when you allow your social circle to limit. So we need to practice socializing. So what can we do to help keep our elder community a little bit more social? Well, if you're a friend, a relative, or a child, adult child, of someone in the elder community, you can start by giving them regular phone calls. You can do video phone calls because seeing you talk, being able to read lips is really important for the elder community because a lot of them do rely on lip reading, and one of the issues that we've had with the masking is that they can't hear you, they can't read your lips, and they just have to kind of assume or guess at what's going on. Now, when we don't hear well and we can't read the lips, that's another level of reducing their socialization and just reducing their involvement with society. And again, that increases risk for dementia. Now, the other thing that can happen with being locked up for 9 months is just plain old depression. And when we have depression or we have untreated depression, that is also a risk factor for dementia or can make people more forgetful and kind of impersonate a dementia. Now, the good news is that that's reversible. What can we do to help socialize and help increase the happiness, for some of these people who have been locked up for 9 months? Well, under safe circumstances, you can actually do a visit with such people. If you are 100% healthy, you have no ill symptoms, you've been immunized, or you've already had COVID, then that might be a good time to go and visit an elder person. As an example, and possibly what really prompted this video, my own mother had a stroke about a month ago. And since I, luckily, had a very mild case of COVID about a month or so ago, I knew I was 100% immune and I could safely visit her. So a social visit was due to make sure she was functioning at a level that was safe, and also just to have continued interaction to make sure that she isn't at risk for dementia that is caused by lack of socialization, depression, and so forth. Now, most old people do have hearing problems. Most old people do rely on reading lips. Most old people during this pandemic have not socialized, while they, as much as they should have or as much as they would have liked to. Now, using my own life as an example and what you can do as well, what do you need to look for if you're visiting an old person? What are some of the safety concerns that we might have? Well, one thing is medications. Now, as a doctor with 20 years of experience, I can tell you there are a lot of well-meaning adult children who have gone home just for a weekend to visit their mom and dad and get what we all actually recommend for older people, a pill box. So they set up a pill box for mom or dad, and they get all their medications set up in the pill box, and a couple days after the adult child leaves, usually the patient, the older person, ends up in the emergency department. Now, why did this happen? Well, maybe that older person really never actually took all the prescription medication that they were supposed to be taking. A lot of older people start to reduce medication. They get nervous about the medication for a variety of reasons. Sometimes they think they're just taking too many pills. Sometimes they can't afford the pills. Sometimes they think the pills are too expensive. Or sometimes they just decide they don't need it. So if we're going to set up a pill box for an older adult or a parent or a relative, we need to look at that pill box, or look at the pill bottles rather, and check the expiration. What is the date on this? Was this pill bottle from this year? Here we are in January. If the pill bottle says September or August, that suggests that that medication has not been refilled in a very long time, and they probably aren't taking that medication. Another way to sleuth this out is to call the pharmacy and see what medications your parent or older adult has actually been filling on a regular basis, and that can give us a clue as to what they're actually taking. You can also give a call to the doctor office and ask to speak to the medical assistant or the nurse and find out what they're supposed to be taking. Now, as long as we're talking about the medicine cabinet and setting up medications, once you've determined what they're actually taking and you've set it up in a pill box to make it easy to remember so we don't duplicate medication, now we want to look at that medicine cabinet and remove any medication that actually is not for that older adult. So if they've had a spouse that has died or an adult child who has moved, if there's a prescription pill bottle in the medicine cabinet or many prescription bottles in the medicine cabinet that do not have that older adult's name on them, you need to throw them away. We also need to check expiration dates for over-the-counter medications, because if those are expired, we need to throw them away. If an older adult is over 65, it is not recommended to take Advil or any other anti-inflammatory without consulting a physician. Now, the reason for this, well, there's many reasons for this, but one of the main reasons is that it can increase risk of heart attack and stroke. It also can increase the risk of GI bleeding, and sometimes just doesn't play nice with other medications. So if an older adult is taking Advil, ibuprofen, naproxen, Aleve, anything that sounds like that, we need to consult with their physician, make sure the doctor knows they're taking that medication, how much that they're taking, and whether or not it's actually safe for them to take that medication, because in many times it is not safe for them to take that. Okay, so we've set up the pill box, we're aware of what medications that we're taking. Now we've gone through the medicine cabinet and we've gotten rid of any medication that isn't actually theirs, any medication that's expired, or any medication that might potentially be dangerous. What else can we do to help that older adult? Well, let's head on over to the fridge. So go into the refrigerator and open it up. Is there actually food in it? I hope that there is. But if there is food in it, you want to take a look at expiration dates here. If they have condiments that are a couple of years old, toss those out. If they have cheese or meat or bread that is expired, throw that out. Get rid of anything that's potentially expired, but also really take a look at what's in the fridge. And if it is mostly empty, then we can safely assume that maybe they're not actually eating healthy meals. A lot of older adults, especially if it's just one of them living alone, feel like it's a lot of effort or trouble to make a healthy meal, and many times they do what is easy. They might use a TV dinner, which usually has a lot of preservatives and salt and really not a lot of nutrition to it. Or maybe they're just eating what's easy, like a can of tuna fish every day or eggs and toast every day. Now, it's certainly okay to do this on occasion, but on a regular basis, we're going to be missing out on needed nutrition. And we know that for the COVID pandemic, as well as many other illnesses, good, healthy nutrition is super important to keep our immune system functioning and to keep our brain functioning. So just to let you know, Meals on Wheels and other similar popular meal delivery services most old people do not like. They think they're bland, they think they're tasteless, they don't like them, and they won't eat them. So one easy thing that you can do, particularly if you live close by, just save a leftover from every meal that you make during the week, package it up in a cute little Tupperware, stick it in their freezer. If you don't live near this older adult, then you can go on a cooking frenzy like I did with my mom. I made probably 6 or 7 meals and separated them individually into Tupperwares, labeled them, dated them, so that now she has a variety of things to choose from for lunch or for dinner, really for the next probably month. And that's important. You have to give them some choices and some varieties and make sure that they're maintaining their nutrition, because sometimes it can feel like a lot of effort to make a healthy meal, and it doesn't take a lot of effort to take something out of the freezer and defrost it. So now we have created a pill box, we've made the medicine cabinet safe, we've thrown out expired foods and condiments from the fridge, we've made sure that they have healthy meals. What else can we do to help out this older adult? Well, the other thing is take a look around the house for clutter. We want to make sure that there are clear ways to get from one room to the other. We don't want to see stacks of magazines. We don't want to see a whole mess of extension cords all strewn up together that potentially could be a tripping hazard. We don't want to see a pile of shoes by the door. We want to make sure that we are doing everything that we can to avoid a fall, because if an older adult lives by themselves and they fall and they don't have one of those life alert buttons, they have no way of really contacting somebody to let them know that they've literally fallen and can't get up. That happens. And if you have fallen and you can't get up for several days, there are so many health problems that can arise, and that usually turns into a hospital stay. So make sure there's no tripping hazards. Cords, shoes, loose rugs, piles of books, piles of magazines. These are really easy things that we can organize for this older adult. It can be really overwhelming for them, or they may have just gotten so used to it they don't even see it anymore. But when you go in and you evaluate the situation, this is something really simple that you can do and really anyone can do. So we have pill box, medicine cabinet, cleaning up the fridge, getting rid of all the clutter. Now those are really easy things that you can do even without a medical degree. And now the last thing is socializing. So if you see that their social circle has been diminished, we have to figure out how we can increase that social circle. Now, if you abide by safety protocols like washing your hands, like wearing a mask, and do not visit people when you are sick or if you feel sick, it is possible to visit an older adult safely and socialize. You can bring them lunch, bring them breakfast, just hang out. You can also read a book together, and that reading of the book together doesn't actually have to take place on the visit. Maybe you're each going to read the same book and then you're going to talk about it when you have a visit. So we need to figure out a way to increase the social circle for this older adult, because we'd like to combat depression, we'd like to combat dementia, and we'd also want to make that older person have the healthiest and the longest life that is possible. So I hope that this video inspires you to reach out to maybe an older neighbor, maybe an older relative, maybe a parent. But there are old people out there right now where this pandemic has been really devastating on a number of levels. And there really are some simple things that we can do. And that simple thing can simply be delivering some muffins or a meal or just sharing a good story. But let's not forget about some of our older people in the community, because although we have immunizations for COVID, it's still going to be a couple of months before that herd immunity takes over, and they still have to kind of lock themselves up, and they're getting tired of it just as well as the rest of you. So thanks for listening. It's Dr. Lucie Bianchi from the Mindful Medi-Spa and Medi-Clinic here in Hoffman Estates. I'm happy to bring this information to you and any other information that you might find helpful. So keep your questions and your requests coming, and we'll keep our videos coming. Have a great day.